Hi, my name is Robbie Daly, and this is my presentation redo. What I'm going to be talking about first is the effective instructional delivery, and the article I chose was the effectiveness of direct instruction for teaching language to children with autism spectrum disorders, identifying materials. This article was written by Jennifer Nance and Margaret M. Flores on June 19, 2008. The type of instruction that was included in the study was direct instruction, but the teachers were utilizing choral response with their students to re-illustrate what they were talking about. And this is, they were teaching children with various cases of autism spectrum disorder. So who was included in this study? 3 elementary school students are all enrolled in a private school that was for students with a disability in the southern part of the United States. The first student that I'm going to talk about is Kyle. And Kyle is a 10-year-old who was diagnosed with autism spectrum disorder when he was 2 years old by a medical professional. And there was 3 tests that they used to administer the prior progress of these students as far as their autism spectrum disorder and as far as the verbal and nonverbal intelligences. So, Kyle's CAR score, which is Child Autism Rating Scale, Kyle was on the severe side of the scale of the autism rating scale. Whereas, and then he was average for the TONI, which tested nonverbal intelligence, and then he tested poor on TOLD, which was test of language development. The second student involved in the study was Aiden, who was also 10 years old, and he was diagnosed with autism spectrum disorder when he was 2.5. And Aiden's CAR score was moderate. His TONI score was below average, and his TOLD score was very poor. The final student in this study was Nico, and he is an 11-year-old boy who was diagnosed with a pervasive development disorder, not otherwise specified, and he had dyspraxia at age 6.5. His CAR score was mild, his TONI was poor, and his TOLD was very poor, like Aiden's. So, how the participants were instructed. First off, they had to identify and understand common materials. And they had to identify and understand 8 common materials. So glass, wood, paper, plastic, cloth, just to name a few. Direct instruction was implemented with choral response. And so the teacher would give them an item, and they had to identify whether it was glass, metal, or some other type of material, and then correct responses provided a choral response. So a wooden table, if the student said that the table was made out of wood, then the teacher would re-illustrate that and say, wood. The table was made out of wood. And the teacher would also correct incorrect responses. So to collect the baseline data, students were asked 3 times per week to identify materials from 8 statements, and this was done prior to instruction as a pretest. So, on average during the baseline, Kyle was able to identify 2 materials, and then the researchers then set his mark at 5. And Kyle exceeded all those marks. So the students were allowed to get up to 6 more materials before the study ended. So Kyle was able to get 8 materials, and then they did a post-test 3 weeks after he understood 8 materials, and he was able to retain that. Aiden, on the other hand, he had 0 correct responses, and his first criterion to hit was 3 correct responses. So Aiden started at 0, and he had to get to 6 by the end of the study, and he was able to do that. And he was able to retain 3 weeks after the final test. And Nico was the exact same as Aiden. So, in our classroom, I would like to implement choral response techniques along with direct instruction. So when teaching our students reading comprehension, when there are key vocabulary words, we can pause for choral response and identify what the word is together so that students can comprehend this language. And I know in a class of 30 versus a class of 3, the study is going to be a little bit different, but we can still implement the ideas of this study. So, moving on, my next section that I had was assessment. And the article that I looked at was Oral versus Written Assessments, a Test of Students' Performance and Attitudes. This article was written by Mark Huxham, Fiona Campbell, and Jenny Westwood, and it was written in the February article of Assessment and Evaluation in Higher Education in 2012. So who was included in this study? This study was done in a university, and it included 2 cohorts of students. The first cohort was 99 first-year students in an introductory biology class. The second cohort was 29 second-year students, and then there was a third group that was not a cohort, and it was 18 third-year students. The study didn't say specifically where this was located, but the article was done from a UK article, so I'm assuming the study was done in a UK university. So how assessments were utilized. So first years were randomly split up into 2 groups, an oral exam group and a written exam group. 15 minutes was allotted to oral exam takers, and an additional 15 minutes, so 30 minutes, was allotted to students with the written exams. And that's because when speaking to students about the oral exam, you can get the answers out faster than you can writing it down. Second years had to take both the oral and the written exam, and this was kind of the control group. And then third years had to utilize their previous knowledge, their previous research, and they had to take both the oral and the written exams. But they also had to continue on with the study, much like the second years. So the results of this study states that students performed better on the oral examinations versus the written exams. And this was seen across the board. Students achieved higher grades and across the board for every level, first year, second year, and third year, oral versus written exams. Then students were given an additional questionnaire where they were asked, okay, why did you like the oral exams, or why did you not like the oral exams? And then the ones that took the written exam in the first years had the same thing but for written, and the one that took both, which do you like better, oral or written exams? And although the students said that the oral exam was harder to take because they couldn't collect their thoughts before they spoke them, and once you speak during the oral exams, your answer was recorded. But once you wrote down, you can erase. But 13 out of 15 students who responded via email on this subject thought or liked the oral exams better. This included a student who had dyslexia, and they said that they enjoyed it better because they were able to not fumble over their words when writing it down, but they were able to speak out their thoughts. So, in our classroom, I will implement oral examinations along with written exams because I think it's a good practice, and the results show that oral exam is beneficial to students. But On the flip side of that, I don't think eliminating written exams entirely from the curriculum will be effective, because it's all about differentiated instruction, and how we have differentiated instruction. I believe we should also have differentiated assessments when teaching our students, because it gives them the best opportunity to succeed. I know that if I can allow my students many ways to communicate with me, that I can understand that they have reached the standard that we have set, then they will be successful. If a student would rather have an oral assessment than a written assessment, then I can make that accommodation for them. And I know that, especially in a class of 30 versus a class, in a class of 30, that this may be hard to do, but we also have homeroom and lunch that students can come meet with us if they feel more comfortable with the oral examination. And make sure that I have my rubrics set out so that my students know what competencies they need to hit.